We'll continue.
Yeah.
Okay, great, great. So, guys, as you know, it was a little delay and stuff. So let's start with this quiz for tonight. And if you want to join the quiz, here is the QR code. And as you know, disclaimers are already been set. So let's get started. Yeah, Dr. Manoj, ready?
Yeah. We'll get started.
All right, great. So moving on to the first question.
Which feeding method is most suitable for a neonate who is born after 35 weeks?
All right. Guys, think about neonates born at a later preterm gestation, usually still in the transition between full term and early preterm, requiring specific support for feeding.
Yeah. To give one more clue, this method often involves breastfeeding with added support, but it's not the primary choice for infants born prematurely at earlier ages.
Okay, so as we can see that we have most of them going with the right
Yeah,
one.
most.
Yeah.
Yeah.
So moving on to the leaderboard. All right. So we have Medha leading the leaderboard, followed by Vishnu Priya. Hey, sir, is it sir who's playing the game?
We don't know. I think no idea.
No idea. Okay. So then followed by Shamli, then Malcolm, then we have Soumya, Shushma, Spoo, S, Aisha, Ashwarya. Okay. Guys, you can play the quiz. The quiz is on. As you know, no negative
Yeah.
marking. So let's get started to the next question, okay?
Yeah.
Your second question.
Which of okay, tell me. Rupal, you can continue.
Okay. Which of the following is an essential component of kangaroo mother care? I hope you guys know this is like a baby question. Baby question.
Yeah. And also it's one of the important questions. We cannot
Question.
neglect it.
Yeah. Somehow they have been, keeping the same PYT and asking the questions in and around. Nice.
Mhm.
Very good. No
Yeah.
one has got this wrong. I'm
Mhm.
glad. All right, guys, this is the spirit. This is how you answer. This is the quickest way. All right. So you're doing great. Let's get going. So we have
Okay,
Medha
we
leading
have
the.
yeah,
Yes, yes.
Medha leading with RMD,
Mhm.
then Vishnupriya, Shamili, then Malcolm.
All right.
So let's get going, guys. Let's move to the third question.
Right.
A 2-month-old infant presents with developmental delay, bulging fontanelle, and signs of increased intracranial pressure. MRI of the brain reveals the following features. What is the most likely diagnosis?
Hmm. What could it be? I mean, I see like all of these, uh, answers, and I feel like one of these.
Very smart way to tell a clue. Yeah, this was a confusion. Rupal, do you know this question had come this year in the second shift?
Yeah. Wow. It completely
Yeah,
skipped my mind. Thank you for reminding me.
we often get confused between these two options.
Right, that's true. That's true. Guys, over here, these two are the ones that they, mix and match and max and match. So you got to know their MRIs and the scans as well. All right.
Yeah.
So moving on to the leaderboard. Naga, please let us know if you're sad and why is it sad. Okay.
Okay.
So we have Vishnupriya leading the leaderboard with the longest streak, followed by Shamili, Malcolm, and Krishna. Now who's Hemant, Ashish, Shushma, Medha, Apu, and RMD Suji. And now we have RDT. Okay, guys.
Okay.
Just okay. No response to your creativeness. All right, moving on to your fourth question. A 3-year-old infant presents with developmental delay, hypotonia, and seizures. The infant hair is sparse, kinky. Blood tests reveal low serum copper levels and low plasmin levels. Positive mutation in ATP7A. You know what,
Yeah,
Dr.
to
Manoj?
give, yeah, yeah,
Suppose I'll
yeah.
give a clue. I would say ki this is like when we have, like write a short description in our professional exams. This is exactly
Mhm.
what we have to write.
Yeah.
All right, guys.
Okay,
I
we
know.
have 12 of them giving the answer as Wilson's.
Right. Okay, so I would like to add over here ki when it is Wilson, no, it is 7B. That is the main difference. I know it is like there are more difference to it, but the main mutation, if someone is saying, so 7A is Menkes and 7B is Wilson. This is how you can like remember one of the points. Okay?
Yeah, yes.
Yes. So moving on to the leaderboard.
Here
Woof.
we have Vishnu Priya, then followed by Malcolm, Krishna, Ashish, then Hemant, Sushma, RDT, RMD, then Appu in the ninth place, and Kushal in
Sure.
the 10th place. We
All
still have more questions, guys. Let's keep going.
yes. Be focused and try to be fast as well. Moving on.
Yeah. A 2-month old infant presents with cyanosis, particularly during crying. On physical examination, a harsh systolic murmur is heard. What is the most likely diagnosis?
What do you think, Dr. Manoj? What it could
I
be?
think seeing the X-ray will get the diagnosis easily.
That's true. That's quite true. Let's see how many have got it.
Yeah,
Oh my God.
most
Nice.
of them I got it right.
I would give this a good confetti. Good one, guys. Good one. I'm very glad that, everyone is just reading and coming and saying, this is very nice.
Yeah, let's see
So,
the leaderboard.
yes. Okay. So we have Vishnu Priya, Malcolm, Krishna, Hemant, Sushma. So guys, you are at a good pace and good speed. Let's keep it going. Moving on to your next question. Question number 6.
Yeah, a preterm baby born at 28 weeks of gestation shows a weak muscle tone and frequent episodes of apnea. Ultrasound scan reveals bright spots in the brain around the ventricles. So, what will be your diagnosis?
In case you're looking for a clue, let me give you one. This condition is often seen in preterm infants, particularly those born before 32 weeks. Remember, 32 weeks se pehle. It is associated with brain injury that occurs in the ventricular zone. E-
Okay, we
Okay,
have 14 of them giving the right answer. Actually, in the USG scan, you can see the hemorrhage, right, Rupal?
right, I can. And
So,
you,
it won't be option
yeah,
one.
right, that's true. Hemorrhage usually occurs, guys, it's written hemorrhage. In the option, it's
Yeah,
written hemorrhage. In the picture, it's written hemorrhage.
yeah,
All right, so guys, just see proper properly. Keep your eyes open so that you're a little attentive more. Okay? Let me just tell you, it is a very common complication of prematurity. Okay? So that is how you can remember.
I think the brain around the ventricles, that is the confusing one. I guess many of them are
Yeah.
selected.
Yes, yes, I think so. All right. I think these are the points where, people will get to know, like all of these aspirants and everyone who's do in this medical field. Then there are points where they get a little tricky. And seeing
Yeah,
over here in first-hand basis, you'll be able to know, key, yeah, this is a little tricky. This can be also a differential diagnosis of the same. So keep an open mind.
yeah. Okay, let's move to the next question. Okay, here's your seventh question. Incubator used to maintain a stable temperature in newborn care prevents heat loss by which of the method? What do
E-
you think, Ru? Can you give any clue?
Well, I would say incubators, I know that prevent heat loss through a method where the temperature of the surrounding air is controlled. So we are sitting in a controlled method, and also heat loss is also prevented. What do you think? It's heat.
Yeah, heat loss. Prevents,
It
guys, it's prevents. It is
prevent.
not given. It
Yeah.
prevents heat loss by radiation. It gives heat by convection.
Gives CIs heat by which convention?
Yeah, we have asked you, it prevents heat loss by which method?
See, so see, guys, just keep an open mind. Just read the questions once before you do it, and you'll know. Sometimes it's just the word difference, single word difference. Okay, so moving on to your leaderboard. Ooh, all right. So we have Vishnu Priya, followed by Malcolm, Krishna, Shamili, Hemant, RD, Sushma, Deep Savalia, Apu, Priya, S. So good going, guys. Good going. And as you can see, each question over here does make a difference. Each question will can get you up the leaderboard as well. And since you know it is no negative marking, we don't have to worry. So moving on to the next question.
Yeah, breastfeeding is continued in all except
I think
in
there are
which of
few
the
dis-
option given below? Yeah, yeah, continue.
yeah, Dr. Manish, I was thinking that there are a few specific metabolic disorders, where the breastfeeding is contraindicated.
Yeah, true.
True. Wait.
Which is
Let's see.
absolutely contraindicated.
Mm-hmm. Nice. Very good, guys.
Yeah,
Very
yeah.
good. Yeah. I like how Peds is a nice subject along with a very scoring one.
Yeah.
All right, guys. So moving on to the leaderboard, we have Vishnu Priya, Malcolm, Krishna, and Shamili with the longest streak. Great.
Yeah.
So good going, guys. Next question.
You go with the question, Rupert.
Okay. A 6-month-old infant presents with episodes of sudden flexion of the limbs, along with a characteristic jerking movement of the head and neck. The EEG is given below. What is the most likely diagnosis? Can
Yeah,
you
to give a
specify?
clue, this
Yeah.
condition presents as a sudden jerks or flexion spasm.
Hmm. I think it usually happens in the first year of life, right?
Yeah, true.
Very good, guys. Well done. You're doing great. So I can see that most of them have, come prepared. And I'm glad to see that. All right. So
Yeah.
moving on to the leaderboard.
Okay, we have Vishnu Priya. then Malcolm, Krishna, Sushma. Then in the fifth place, I think we have
No, Priya.
Priya, then Appu, S, Rakshaya, then Shamili, and Hemant. Okay, guys, we have 11 more question, including the 10th one. Here goes, Dr. Rupal, you can take this question.
All right, sure. So, growth spurt is seen in girls at what stage of Tanner scale? Guys, I would like to remind you over here, this is exactly a PYT. It is a PYT. They have asked this a plenty of times and on a recent basis as well. So please
Yeah,
let.
please revise these topics at the last before going to the exam. Very useful.
And these are the ones that we call them volatile because they are the ones that can, miss your mind. So always have a look.
Yeah.
So we have Vishnu Priya leading the leaderboard, followed by Malcolm, Sushma, and Priya and S, and Priya having the longest streak. Hey, nice. All right. So 11th question in front of your screen right now. Please continue, Dr. Manoj.
Yeah, child came with the following finding, which uh, I think, guys, can you see the image?
Nahi.
The image is nothing but bowing legs in lower limbs.
Indolence. I'll give you another clue. Rickets hai, bone pain hai, and muscle weakness bhi
Yeah,
hai.
yeah,
I Let's see if you can guys. Rickets hai. Oh. Yeah, don't worry. We'll discard this one since there was a little glitch from the end. So don't worry. But as we can, if you would like to hear the question, uh, it was rickets. The symptoms were rickets, bone pain, muscle pain as well.
yeah. Okay, let's see the move on to the next question.
Right. Good going, Priya. You're holding your stand straight and have the table stone. They have. So Matthew is reading the leaderboard, followed by Vishnu Priya and Priya. All right, guys. So moving on.
So here comes your 12th question. Meconium is normally passed within. What do you think, Dr. Rupal?
Dr. Manoj, I suppose it is the first tool, but that is passed by
Yeah,
a nameplate.
yeah, I always thought urine comes first.
Yeah, but it is the stool. And the timing is also important because it tells us about the intestinal functioning. It's an important indicator.
Yeah, true.
All right, guys. Great. Great. So most of you have got this right. Good going. Let's see. Oh, the tables keep turning.
Yeah, we have Malcolm in the first place, then second place Sushma, then third place Vishnu Priya. At the fourth place we have Priya, then fifth place we have Dr. Krishna.
All right, guys. All right. Great going and good going. Let's move on. Every question will give you extra points and it will help you to revise as well.
Y- Rupal, you can take this.
Okay. Today, a 2-day-old newborn of a diabetic mother had seizures. His blood glucose was 56 milligram per deciliter. Serum sodium is 142, and serum potassium is 3.8, and calcium is 6.2. What is the next immediate step in management? Let's see.
Let's see.
Oof.
Okay, most of them have got it right.
And then I suppose it's cool because we know that calcium gluconate does help.
Yeah, I
Yeah.
think if you know the doses, then it would be easy.
Yes. That's that's one way to put it. Yeah. But you got to
Yeah,
know. All right. So we have Malcolm holding the longest streak, Sushma, followed by Vishnu Priya, and then Priya. Let's go, guys. Let's get moving and let's go.
Yeah, here comes your 14th question. Induced hypothermia is used as treatment for which of the following condition?
Hmm. If you'd like to have this clue, I would say intervention is commonly used in neonates after hypoxic ischemic event to help reduce neurological damage.
Yeah,
We cool the baby, guys. The goal over here is to cool the baby.
yeah.
Nice.
Okay, let's see the leaderboard now. Okay, not much changes, but we have Malcolm. Then at the second place, we have Dr. Priya, then followed by Dr. Vishnu Priya, then Dr. Hemant, Dr. Krishna, then we have Dr. Ashish, Dr. Sushma, Dr. Urvashi, Dr. Apu, and at the 10th place, we have Dr. SM.
All right, guys. So, a little drum rules. You have been, since you're doing great, let's get moving.
Rupal, you can take this.
Okay. A 2-day old infant born to mother with poorly controlled diabetes, present with signs of respiratory distress, low blood sugar levels, and an enlarged liver. The infant's birth weight is significantly higher than average. What is the most likely diagnosis? Guys, this is baby question. It's
Yeah,
literally a
important
baby.
topic as well.
Yes. All right. Good. You were not tricked by others. Nice. So moving on.
Yeah, I think this question balances the image question which we missed.
I agree, Dr. Manoj. I do. All right. So good going, guys. Keep the spirit up. Let's go, Dr. Manoj.
Yeah, Rupal, you can.
Okay. A newborn presents with absent sacrum, shortened lower limbs, and no anal opening. The mother has a history of poorly controlled diabetes during pregnancy. What is the most likely diagnosis? This is another
Yeah,
baby
this is
question.
a yeah,
Yes.
and this is also a very important congenital malformation which you have to remember.
You gotcha, you gotcha. Nice. Nice, guys. So we see most of you have got this right, and we're very happy as you have come prepared. So let's go. So a little change. We have Malcolm leading the leaderboard with the longest streak. Ashish, Hemant, Vishnupriya, and Priya. Nice. Nice going, guys. Moving on to your 17th question.
A 1 week old infant is assessed and found to have an absent Moro's reflex. The infant also has poor muscle tone and weak crying. Which of the following condition is most likely associated with the absence of Moro's reflex?
All right. So, as you could so understand, it's a neurological disorder which can present with signs of hypotonia, weak cry, and it affects infant at an early age. Yeah.
Yeah, most of them has got it right. This
So
was an
see,
easy one.
yeah, this was the easy one, and I would say that understand that even though it is a short topic, it can be asked in two, three more and more different ways. So
Hmm.
it's good to know that you are doing great.
Yeah. Okay, we have Malcolm at the first place, then second place goes to Ashish, followed by Hemant, Vishnupriya, and Priya at the fifth place, Sushma, Krishna, then Urvashi, SM, and Surya.
Dr.
So we
Manoj,
have,
it's
yeah,
like a little less fighting, but exact amount of fighting. Like everyone is answering and everyone is
Yeah,
doing it.
yeah, true.
Nice, yeah. Very good, very good. To your 18th
Yeah.
question.
A newborn is examined shortly after delivery, and the skin is found to be covered with a white waxy substance. This substance is most likely to be,
Let's see. I think I would say the substance is produced by sebaceous gland during fetal development. What would you
yeah,
say?
mm, yeah,
It's
true.
a preterm
I
infant,
think
no?
this is all these. Yeah, yeah. No, no, it's a normal infant.
Okay. Okay. You were saying?
It's a normal infant. I think we can see this finding normally also as well
Hmm.
in normal
Yes.
term babies.
Yes. That's right. That's right. Okay. Ooh. All right, guys. We're coming close to the quiz tonight. Let's see. Keep the space up. You may win the grand finale title. All right. The winner title
Yeah,
as well. So let's
yeah.
see. Sixth last question.
Rupal, you can take the next two questions,
All right,
both
great.
19 and 20.
Sure. So, which of the following is the most common cause of bronchiolitis in infants?
Guys,
I
this virus is very highly contagious and spreads primarily through respiratory droplets.
yeah, good one. And I suppose it affects the lower respiratory tracts in infants, which is causing the
Yeah, correct.
bronchiolitis. Nice, nice. I am glad. All right. Oof. Now close calls, guys.
We
Close
have
calls.
everyone is moving in the same pace.
Jeez, yeah. All right. So, guys, coming on to your last question. All right. The final question of the grand finale of Peds is here. A two-year-old child presents with a barking cough, hoarseness, and stridor that worsens at night. The child has a history of upper respiratory tract infection. On examination, there is inspiratory stridor, and the child appears mildly distressed. What is the most likely diagnosis?
Yeah, to give a clue, this condition often follows an upper respiratory infection and causes inflammation in the airway, leading to hoarseness and a characteristic barking cough. I think most of them got it right.
Woo! All right. So, guys, with that, we are here. All applauses. All applauses for everyone who has participated today in this grand finale. We are glad. Let's see who has won the grand finale.
Okay, it's Malcolm wins the pediatric quiz as well. I think he won the biochem as well, right?
Biochem, yeah, yeah. Nice, nice, guys, nice. Wonderful.
Congrats,
Applause.
guys.
Congratulations. Congratulations, Dr. Malcolm. You have won the grand finale of Pediatric Quiz, and we are very happy and very glad that you have participated. So, coming on to the
Yeah.
second place.
Second place goes to Dr. Ashish. Congrats to you too. And third place goes to Dr. Vishnu Priya.
All right, guys.
Congratulations, guys.
Woo! So, guys, thank you. We had a big blast, and thank you for coming and joining us today for more quizzes. Keep joining at 10 p.m. every day.
Yeah. And also, guys, from tomorrow we'll have surgery. for next 6 days. We'll forward you the timetable as well in the Telegram group and in other socials.
Right. We'll keep you updated, be updated, follow us on all socials so that you are updated as well. Great job, everyone.
Yeah,
Uh, Stay tuned. Like, share,
yeah. See you
subscribe.
guys in the yeah. See you all in the surgery quiz as well. 10 p.m. daily.
Daily. All right. Thank you, guys. Good night.